Okay, so for the last time today, good afternoon. I'm Veda Peters, Lung Association staff. This is the 11th annual Air Quality and Health Workshop, and I'm here with Dr. James Liu, Medical Health Officer for Vancouver Coastal Health, and we're going to chat a little bit about health impacts assessments and the energy sector. So what is a health impact assessment?
Health impact assessment is a decision support tool. What it does is that it's a process, a very structured process where different types of methods, tools, analysis are used to determine whether or not there are impacts to the health of a population or whether there are differences to the impacts to different subpopulations from a policy, from a program, or from a project. The health impact assessment is meant to, at the end, provide some identification of potential positive impacts as well as negative impacts, and looking at recommendations around how we can enhance benefits or the positive impacts and how we can mitigate or decrease the negative health impacts.
And how does that differ from an environmental impact assessment?
In some ways, they're very, very similar. HIA, I think you can say, has its roots in EIAs in the sense that it follows very much a same process of screening, scoping, analysis, identification of needs, reporting, recommendations for mitigation and monitoring. What HIA and EIAs differ is in that environmental impact assessments, by and large, traditionally have focused on the effects from changes in the physical environment from a project, for example, the release of an air pollutant or the release of a chemical into the environment. And you start from that perspective, whereas from a health impact assessment, we start from the population that may or may not be affected. We look at how the project as a whole may affect that population, including the physical environment changes, but also other changes that may happen because of the project. So that in essence, what the health impact assessment does is that it looks at the different determinants of health that are in addition to the physical environment. For example, our social environment, our economic environment, social support, employment status, our lifestyle choices, our early child development, all those things that may come into play.
And does that differ again from a human health risk assessment?
Yes, a human health risk assessment is a very detailed, specific assessment that are conducted to look at the risks from a particular chemical, toxicant, or air pollutant. It looks at the direct effects of that pollutant or that substance. It look at simply the response of people to that substance and decide whether or not there are any risks. For example, it goes through the steps of hazard identification, your dose response relationships, your hazard characterization when you sort of looking at the exposure plus the dose response, and then you sort of do some conclusions. By itself, human health risk assessment can inform an HIA in the sense that if you have a substance that is part of the physical environment that you need to look at its impact, you can use the information out of a human health risk assessment to inform you. But itself is not a health impact assessment.
Okay.
And at the same time, human health risk assessment is also used in environmental impact assessments to inform EIAs in terms of the risk.
And are there examples of a health impact assessment being used in the energy sector?
There are a few. I don't think it's something that has been used a lot, although I think some of the international associations, for example, for oil and gas, their association has had sort of guidelines for HIAs, but in North America, there are some examples. There are examples, for example, of biomass burning projects in California. There are examples of what's quite a few HIAs done in the state of Alaska. In particular, there was one done in around the North Slope oil development, looking at the impact, not only the direct impacts from what the release of the chemicals from the oil developments would be, but also looking at the changes that development may bring into the communities, into the lifestyle, into diet, and its effect in chronic disease for people living up in the North Slope. Also, you can certainly that there are a number of, in particular, I think in Colorado, in the Garfield County, there has been a HIA conducted for fracking wells. And there is the other one I mentioned in the slide is a HIA done to look at energy alternatives for the state of Kentucky, looking at, I guess, the benefits and the risks of moving away from a coal-dependent energy production energy source in the state of Kentucky, and looking at alternatives and options and whether those would be of benefit to health.
And would there be opportunity for an HIA to be used someplace in British Columbia?
I think certainly there are a number of things in the energy sector that's coming up in British Columbia that I think could benefit from an HIA approach. For example, the LNG project that's being proposed on the coast. But I think some of the things that I think the HIA would be of advantage is actually looking at some policy options around maybe energy policies for British Columbia, looking at the health impact of the different choices, whether we go hydro, whether we go natural gas, or what other sort of energy sources. And those are possibilities that I think are there in terms of using this approach to help us to better understand how a project or a policy may impact health. Now, one of the things that I think in the future that we hope to do is that if we are able to not just sort of do independent HIAs by itself, but somehow we can be able to embed or insert the principles and the aspirations of HIA into an existing environmental assessment process, for example, like the BC environmental assessment process, so that you're not doing double work, but you're actually adding value to what's already existing.
So a bit of a challenge to get a health impact assessment embedded into the process, but also it would be an advantage.
That's correct. And I think the challenge for embedding it is, I think, probably the traditional view of health and the impact from projects. I think the traditional sort of very narrow view of, it's only the chemicals that's going to come out of the stacks, for example, that's going to have an effect. I think we need to be able to help our decision makers to understand that there are certainly quite a large number of other determinants of health that projects like these can influence, and that we need to consider them as well.
Okay, thank you, Dr. Liu. I believe we've answered the questions.
Thank you very much.